Well, September is Healthy Aging Month. It's an annual observance aiming to help people focus on the kinds of diseases they face as they grow older, along with what we can all do to stay healthier and live longer. So here with us right now to speak more on that is from St. Peter's, Dr. Michael Burke. Thank you for joining us, Dr. Michael.
Thanks very much. Good
So
to be here.
on average, women, we live 7 years longer than men. Why is that?
So I believe that change is likely due to hormonal differences, and there's a protective benefit from estrogen that women enjoy until menopause. And after that, chronic diseases will begin to catch up.
And because they live longer, they do have some unique health challenges they face. What are the diseases that we should be looking out for as we age?
Well, women should always focus on cardioprotective health. Certainly that's the number one killer of women as they age. Interestingly, women die of strokes 2 times more likely than men do. So cardiac health is very important. Screening for breast cancer, again, number 2 cause, and again, important. Autoimmune diseases. So women are, I believe, 50 million Americans with autoimmune diseases. 75% of those are women. And of course, osteoporosis, a big concern. And bone health is particularly important.
Now, on top of making sure we get those regular screenings and we go to the doctor consistently, there's also lifestyle changes that we can make, which sometimes are undervalued. What are some of those that you suggest?
Well, certainly. And I'd preface it by saying that lifestyle changes, there's nothing too little and there's nothing too late. And not particularly exciting. I think you've heard this before, diet and exercise. Right. Diets of particular importance. Avoiding ultra-processed foods would be a key factor in healthy aging. And exercise, recommendation is 30 minutes a day, but really anything you can do is going to help. Getting enough sleep is important. There's a lot of discussion about brain health and trying to have some cognitive stimulation, and that can be really anything, picking up a new task, or perhaps using your time or talent to volunteer. It would help with cognitive stimulation, but also allow for volunteerism, social connectedness. Being connected is protective and very important.
Now, as you're talking about brain health, our mental health, it's not only the physical changes that happen, but women are also more prone to being diagnosed with depression as they age, and that's a top concern. What's something that maybe, if people are listening out there, they themselves should look out for, or even they should look out for in their mothers and their grandmothers?
So certainly another one of those diseases that we would consider screening for, and following up with your primary provider, your health care provider, your healthcare system, your trusted provider for care is going to walk through those screening tools with you. Depression would be a particular concern. And you're going to look, is your loved one withdrawing, not as excited about activities that they probably once were, changes in sleep patterns, irritability. So key factors to look for and something we can easily screen for.
Doctor, thank you so much for joining us today and giving us some insight on how to live that happier, healthier lifestyle, which every woman deserves.
Thanks very much.
Thanks so much. It's 7:58 right now. For more resources and to find all of our Women's Health Wednesday segments, of course, you can always head to our website, news10.com, and look for Women's Health right under the Community tab.